Biggest decision when going forward with dental implants, you gotta make sure that the provider you see has done this before, that you feel comfortable with them, but you wanna find somebody who cares as well. Dental implants traditionally are an alloy titanium, so it's a mix of titanium. It's the only metal that actually integrates into the body. We'll put teeth on there immediately, and we let that heal in what are called your temporary teeth for about 6 months. It's important to educate my patients because I want to make sure our expectations are the same. There's a lot of things that factor into what your final result's going to be. The worst thing to do is to overpromise and underdeliver. So I've never had a patient get dentures and then get implants and say, give me my dentures back. You can eat what you want. You don't have too many limitations. They do have dentures. It's the movement. It's the lack of stability when they're eating or chewing. It's the gagging. Tasting food can be an issue because suddenly you've got this piece of plastic on the roof of the mouth. All on 4, it's a good, fairly fast option to get something back that's fixed in place. And with the materials I use, you're able to eat fairly normal food within the first 2 weeks, actually. So you're not on like a blenderized soft food diet for the next 6 months as the areas are healing. The materials I use on top to make your teeth can vary, but we typically use something called Zerlix, which is the temporary material I use. It's a lot stronger, and then we'll transition it to something called zirconia, which is more aesthetic, cleaner. You can eat whatever you want with those teeth. I try to make everybody's smile as customizable as possible. So a lot of it starts with a conversation with the patient, essentially, and asking questions what your goals are, what you're looking for your final result, and then figuring out how I can get there. The maintenance tips I give for patients, you'll still get food in some areas, so you still have to use a water pick or a water flosser, and it helps move the food out. But really it's just the water pick and a mouth rinse that you can use, and that's pretty much it. Once you're in your final teeth, I'll see you once every 18 months. We'll take x-rays of the implants to make sure bone levels haven't changed. If your hygiene's been good, sometimes I don't even take the teeth off, and the maintenance is free. I don't charge for it. I think I make patients feel comfortable with their decision. So I have a lot of examples to show them of what the final outcomes can be. Patients have a direct line access to me, so if they have questions, they can reach out to me directly. Here to help manage anxiety. We can put you to sleep. You can have different levels of sedation. There's more of a conscious, there's a moderate, and there's a deep to general anesthesia if you want that. At the consultation, you'll meet me. I don't have a sales team or sales rep. We'll take usually a 3-dimensional x-ray, and we'll take a lot of photos just so we can look at them together on the big screen TV. And I usually reserve about an hour for each patient. So if it need more time, then we'll just take more time to answer any questions that you might have. The first step I'd take if you're interested or curious about looking to improve your smile is I'd make it a consultation. They're complimentary. I'll tell you what I think can be done, what can't be done. If it's something that me as a periodontist can just tackle myself. If you have any other questions, I'm happy to help you out with that stuff too.